Okay, hi everybody. So this is a Healthy Joints, Healthy Lifestyle show. And for those who don't know me, my name is Dr. Dada. I help people with autoimmune disease get their immune system back on track, and people with joint pain become pain-free. So I want to do a series on, this is going to be the third in a series on gout. And at this time, we want to talk more about chronic gout. I mean, I had a lecture I gave the other day and people had a lot of questions. So I want to use this to answer kind of most commonly asked questions that people are dealing with when they have chronic gout. So a little bit about gout. Gout is a condition where people have too much uric acid, and uric acid can build up not just because of what you're eating, maybe because of your genetics, maybe because the kidneys are not functioning well. In fact, 1 in 4 people who have kidney disease will likely have gout. So gout, as you know, most people know, is very painful because uric acid crystals end up inside the joints, and when they end up inside the joint, they cause severe pain. So this particular lecture is going to be more, so this is a third, and this lecture is going to be more about what happens when you've had so much deposition of gout that you end up with chronic gout. So chronic is anything that's lasting for more than 2 weeks, but in chronic gout world, we're talking about things that have been going on for years. So people with gout may say, well, when I have the acute attack, I treat it. Right, so uric acid crystals, they get inflamed and you treat it. So people can treat it with anti-inflammatory medications, which is never good because it can kill your kidneys. They treat it and then they wait until the next episode and then they treat it again. Unfortunately, that does not help the problem because it's like a Band-Aid. You know, you might as well put an ice pack on there to calm it down, which is great, but it doesn't prevent the next attack. But the problem is when the uric acid is in the joints, it's actually causing damage to the joints. So one of the medications that we have is called Krystexxa, and it's really used to help to melt away these lumps and lumps of tophi. So I had a patient the other day, I walked into the room and he raised his elbow and I saw this lump on his elbow. That's tophi, and that is not just sitting, it's a lump of uric acid. It's not just sitting there, it's actually damaging and destroying the joints. So what we want to do for such people is put them on a medication. It's an intravenous medicine, an IV medicine, like an IV drip, that is given to people to help to melt away the crystals. And you know, I tell patients, right, the Krystexxa in the world of rheumatology is almost like comparing, you know, the technological advancement, right? It's almost like, you know, the improvement it's actually the most amazing thing that's happened in rheumatology in the last decade. And it's really made a dramatic impact in the lives of patients, right? So I had a patient who was a software engineer, and this is a few years ago. This is actually the first person I tried to use Krystexxa on. We treated him with Krystexxa. He came in, I think it's probably about, this definitely pre-pandemic. So this is probably about 2017. And he came into the clinic and he said, Dr. Dada, am I going to need to go on disability because of my gout? His gout has affected his hands such that he could not type, and he's a software engineer. Well, and so I said, you know, your gout is so bad that, you know, you have these lumps on your hands and it's damaging your joints. He started to notice deformities. He can't move the joints as well. And so we said, you know, we talked to his insurance company, we got it approved, and we got him the intravenous medicine. He came in, he was the happiest person in the world. He would come in every 2 weeks and get his infusion. This medication, it can only, unfortunately, because of how it's made, it can only be given by IV. There is no pill form of the same medication. And within 6 months, we were able to clear all those lumps of tophi. Some people need to be on it for longer, just depends on just how much you had. He was so cleared. He was able to, he got a promotion. He ended up moving to San Francisco, but he did not have the deformities anymore. He would come in like clockwork every 2 weeks, get his infusion. We have an infusion center that, you know, we have nurses that have been doing infusions for the last 20 years. So you're in good hands. But we just, you know, I just wanted to kind of have some time to talk to people. It's scary. I understand that. It's scary to be on a medication that's an infusion, but I can tell you that it has revolutionized the treatment of people with lumps and tophi. If your doctor tells you that, hey, you know, this uric acid crystals is damaging your joints, we really should be advancing towards the Krystexxa. And Krystexxa is not a lifelong medication, but it is a medication that can use to melt the crystals. We have patients that have had to be on it for a whole year, but this medication, I think, has revolutionized the treatment of chronic gout, just not any gout. Like if you have mild gout, then no. But if you have gout where you have tophi that is damaging your joints, then it's definitely time to have a conversation with your doctor. Side effects of this medication include the risk of allergic reactions. And the good thing is that it's been around for long enough that we know how to prevent those allergic reactions. We also know the people that are more likely to have allergic reactions when they've been on Krystexxa. So one of the things that we do is we give a medication called methotrexate. Methotrexate is a medication that we've used for the last 50 years. It treats inflammation, but the number one reason to be on it is that it helps to prevent allergic reactions to Krystexxa. So your doctor would first of all put you on the methotrexate, which is like 5 to 6 pills once a week of this medicine called methotrexate, and it helps to prevent allergic reactions to Krystexxa. So some people say, well, once I'm on Krystexxa and everything is working, do I need to still be on methotrexate? Yes, you still need to be on methotrexate because it helps to prevent allergic reactions to Krystexxa, right? So that is, I think, number one in terms of side effects. And we also check your uric acid level just before you get the infusion, like a day before or 2 days before, because if you are more likely to get an allergic reaction, your uric acid levels will rise. One thing that Krystexxa does is that, you know, normally we say, oh, you know, if you have gout, we want your uric acid, when we draw your blood and we check your uric acid, we want your uric acid levels to be less than 6. Krystexxa, it gets your uric acid like to almost unreadable. But if somewhere in the treatment, your uric acid level starts to rise, that tells us that, hey, you may be developing antibodies and you may not be able to use the Krystexxa for longer. So it's really, you know, it's an amazing medication. It should be given in the right setting. So under the supervision of your physician, rheumatologist. It should be given in an infusion center. I would not recommend you get it at home because of allergic reactions. You should be in a place where it can be taken care of. When we use a regimen, when we give you methotrexate, when we monitor your uric acid to make sure that it does not rise, then we can lower the likelihood that you have an allergic reaction. But I would tell you, I've been practicing rheumatology for the last 20 years, and this is actually one of the most remarkable things. Like I say, it's a comparison between how we used to treat gout when we compare the cell phone and when we compare the village gong to the cell phone. That is a dramatic improvement that our patients have noticed in their quality of life. From my standpoint, this also has made a dramatic improvement in the function of the joint, right? Because our goal is to help you become a healthier version of yourself. And part of that is to make sure that we maintain your joint function. You know, we have 90-year-olds that are hiking, and that's what we want to do. We don't want your joints destroyed with gouty tophi. So this is one of the conditions that as rheumatologists, we're so happy to treat because we actually get results for our patients. And so remember, we work with you as a team, right? So I made this video just to help our patients. And so don't forget, if you have gout, chronic gout, acute gout, reach out to us at Overlake Arthritis and Osteoporosis Center. We have nurse practitioners, we have physician rheumatologists with, I think combined, we have almost 40 years of experience under our belt. If you add it all up, we have an amazing team that will help you. If you have questions, we're here to help you. But I would say it's certainly worth your while to talk about it. And if you're not in the greater Seattle area, talk to your rheumatologist. Tell your primary care doctor, hey, I have this gout tophi. I need to talk to a rheumatologist. And I think most rheumatologists are there to help you and to help you just become gout pain-free, okay? You take good care. Thank you for listening. Share this video and subscribe to our channel at Healthy Joints, Healthy Lifestyle with Dr. Dada. Take care.